Diabetes is a metabolic condition that results in elevated blood sugar. Diabetes is characterized as either type 1 or type 2. With type 1 diabetes, also known as juvenile diabetes, patients must take insulin from day 1 of diagnosis. Type 2 diabetes is typically considered adult-onset diabetes and is frequently associated with genetic predisposition, obesity, and a sedentary lifestyle. Elevated blood sugars result in damage to both nerves and blood vessels. As a result, diabetics are at risk for developing both peripheral neuropathy and peripheral arterial disease. Peripheral neuropathy is the term used to describe dysfunction of the peripheral nerves and is very common with diabetes. Symptoms of peripheral neuropathy include burning, tingling, and numbness in the hands and feet, dry skin, toe deformities, and joint instability. With peripheral neuropathy, patients are unable to sense pain and are unaware of injury to the foot. Injuries included and not limited to burns, stepping on foreign bodies such as glass, and joint dislocation frequently occur in patients with diabetic peripheral neuropathy. Peripheral neuropathy is highly associated with diabetic foot ulcers. An ulcer is defined as a loss of both layers of the skin. Foot ulcers create a portal of entry for bacteria that can lead to infection and limb amputation. Diabetic foot ulcers cause 85% of all non-traumatic lower extremity amputations, and 15% of diabetic foot ulcers result in lower extremity amputation. Peripheral arterial disease, also known as PAD, occurs when there is decreased arterial blood flow to the lower extremities. As a result, tissues are deprived of oxygen, and this can lead to pain, poor wound healing, tissue death, infection, and lower extremity amputation. Symptoms of peripheral arterial disease include cramping in the back of the legs with walking, which is also known as intermittent claudication, non-healing or delayed healing of wounds, pain with rest that is relieved with holding the foot down or in the dependent position, and in severe cases there is tissue death, also known as gangrene. In order to reduce complications related to diabetes in the feet, establish a relationship with a podiatrist for a baseline exam and determine if there are risk factors. If risk factors are identified, I recommend routine foot care, including debridement of nails, corns, and calluses every 10 to 12 weeks. Other recommendations for reducing problems include avoiding barefoot walking at all times and wearing a hard-soled shoe. This will reduce the incidence of stepping on a foreign body or developing a thermal injury. Check all shoes for proper fit and be sure there are no areas of friction or pressure. Maintain tight glycemic control through diet and exercise. Exercise on a regular basis to improve blood flow and control your blood sugar levels. Maintain regularly scheduled appointments with your primary care physician and, if indicated, your endocrinologist, vascular specialist, ophthalmologist, and nephrologist. Check water temperature with your elbows, as peripheral neuropathy can affect the hands. Stop smoking. Maintain a diabetic-friendly diet. Take all medications as instructed. And finally, know the signs and symptoms of infection, including redness, swelling, heat, pain, loss of function, elevated blood sugars, nausea, vomiting, fevers, and chills. If you ever have signs or symptoms of an infection, please feel free to contact me at any time or present to the nearest emergency room.